Emanuele Capaobianco is the Director of Health and Care at the International Federation of the Red Cross and Red Crescent. He joins us from Geneva. Emanuele, always a pleasure to have you on the programme. Do you still hear stories of a lack of PPE around the world?
Well, yes, we hear stories of lack of PPEs in some parts of the world, particularly in low-income countries, in countries where people are facing maybe not only COVID but also Ebola, as it's happening in Guinea and the Democratic Republic of Congo. What we hear that is very dramatic and has been reported by Amnesty in this important report is that in more than 100 countries, health workers are not being vaccinated. By 100 countries, nobody has been vaccinated. So we have a real emergency at hand to bring vaccination in these countries and then to prioritize health workers, all health workers, frontline health workers, doctors, nurses, but also volunteers like Red Cross, Red Crescent volunteers, also cleaners and other staff that are at high risk of getting the infection.
But vaccinations can't be the complete panacea for everything to do with COVID-19. Surely there must be other protective measures that can be put in place. Is there still a lack of consensus that COVID-19 and the coronavirus is primarily an airborne disease? Because I spoke to an expert at the University of Chicago. It was 6 months ago, and she said she doesn't even believe that that fomites can give someone COVID-19 because she doesn't believe that enough through touch can be ingested into the body. But there does seem to be some kind of discussion going on amongst people who are saying, oh, no, we must still all wash our hands because at the end of the day, we can get coronavirus like that. Other experts are saying, forget that. It's all about what's in the air.
Well, the evidence is fairly clear in suggesting that the main transmission is airborne. So it's really by protecting ourselves with masks, by avoiding crowded places, by keeping distance, that we can protect ourselves from this disease. Washing hands doesn't harm, protects against a lot of diseases, so it's something to be recommended, and it's something that we shouldn't be discussing about. It's a good measure to be implemented, but certainly the transmission through the air is what is the element of biggest concern for all of us.
Emanuele, I want to put this question to you, and it's a little bit of a strange one, but it comes actually from an emergency doctor in Australia. His name is David Berger. He says, how is it possible that healthcare workers around the world continue to allow themselves to be shuffled, he says, with so little active resistance up the line to death? In other words, I think he's saying that doctors, nurses, and healthcare workers need to say to their governments, this isn't good enough, and you need to do more.
I tend to agree with this statement because doctors, nurses, and volunteers like Red Cross, Red Crescent volunteers have been putting their lives on the line of duty every single day for the past 14, 15 months. And we have a risk for them that is the risk of contracting the virus. We also have a risk, it is not a risk, it's a fact, that is all the psychological pressure that doctors, nurses, and volunteers have been facing day in and day out for this long period. They need to be protected with PPEs, but they need to be protected with a psychosocial support program. Some of them may need to be protected through financial means. And I think prioritizing the needs of those people that are helping others, helping the helpers, is a priority for any government that has at the core of its function to protect the people that are most important within the societies. And right now, doctors, nurses, and volunteers are really at the cornerstone of the fight against COVID-19.
Absolutely, they are. Emanuele Capaobianco, thank you so much, Emanuele. Take care.
Thank you.